In assessing Julie's body assessment, you definitely notice more of that C shape. And so her body fat mass is higher than preferred, and her skeletal muscle mass is lower than she prefers, given the fact that she wants to restore functionality and movement from previous injuries. So part of my behavior prescriptions for that is to prioritize sleep, make sure that we're recovering from workouts, and also reducing stress so that we're not in that fat storage mode as frequently. Exercise wise, we're going to do principles of gain, starting with a beginner full body 3 days per week, and incorporating some weights, although she'll be training out of her apartment and has minimal access to weights, but will eventually join a gym. But in the meantime, we're going to really focus on those higher time under tension, developing muscle motor coordination movements, and I'll get more into that when we talk about her movement assessment. And nutrition wise, she has a great foundation in nutrition. Just as it happens, she actually probably isn't eating enough and is storing a lot of fat. And so a component of this is just looking a little bit deeper into her nutrition assessment, and I explain in the other part of the final project how we'll approach that. Also incorporating aspects of sustain, starting at map 10, taking her to about map 7, maybe map 6, but really over the course of the next 12 months, focusing on map 10, doing this in 8-week periods, down to map 9, 8, and for sure 7, and then probably cycle back to map 10 starting next year. So her body assessment definitely shows room for improvement. She wants to lose weight, although it's not her main priority. Her main priority is to get stronger, and she's vocalized that quite a lot. She doesn't care as much, in her words, about her weight. She wants to be able to move better. She was an athlete in the past, and that's something she really values. And so that's what our behavior and nutrition and exercise is going to focus on, since she doesn't prioritize body composition as much as she does her ability to move. So moving on to the movement assessment, some things to keep in mind. She found it challenging to keep her torso vertical on the squat and was not able to reach below parallel. There was some asymmetry in all movements, but particularly in the lunge. She had really poor balance and instability in the lunge and really had trouble with this movement, and noticed different sides of her pelvis were dipping in order to kind of compensate for that lack of stability, and left and right are definitely not the same. She expressed a lot of discomfort in this movement. She has a nice natural curve in the hinge and minimal discomfort, although some in touching her toes. Limited mobility in the ASLR. Mentioned a lot of hamstring tightness and a little bit of asymmetry left to right there as well. And honestly, an inability to hold any planks for more than 10 seconds. She has a lot of hesitation in her low because of a previous back injury and surgery a few years ago that she hasn't really recovered from. And so it's really important that I refer out to help treat this injury and do a physical therapist, but also work with her within those bounds of my scope to help strengthen her core somewhat. And so instability, discomfort, and asymmetry were kind of main themes that I saw in her movement assessment. And so what we'll do to address this in her exercise prescriptions is high time under tension movements in all movement patterns: squat, hinge, lunge, push, pull, and core. And so we'll just be spending a lot of time under tension. Like I said, a lot of focus on body weight movements at first, just to get her used to these movement patterns, with some resistance with training implements. We're going to focus on single arm and leg movements, starting with the weaker side in the push, the pull, the lunge, a little bit of squat. We'll incorporate some of that and really try to fix some of these asymmetrical imbalances. We're going to incorporate R&T. She does have bands, so I would like to see some of that in the lunge patterns, and she's really insecure kind of in that position. And then we're gonna play around with some various loaded positions that push her comfort level, particularly looking at something like a goblet squat, since she's really kind of has trouble keeping her back straight up, help her focus on that core. And then we'll do a lot of suitcase loaded positions as well when we're doing different lunge patterns, things like that, try to fix those asymmetries. And same thing if we're doing like a single arm banded movement, we're just going to really kind of focus on core position and body position in those different movement patterns. So we'll play around with that. And then core exercises, a lot of practice in isometrics. I think part of this is the longest you might be able to hold, like a side plank, for example, might be 10 seconds. So I might start her off with something like hip taps with a long as possible hold at the top. So taking away the pressure and the fear a little bit of that movement pattern and allowing her to kind of play around and express that movement in a side plank position, but also under the assumption that you can come back down when you're uncomfortable and tap the ground and then come back up and just hold it as much as possible. So I'm going to play around with some of those isometrics practice, and also focus a lot on the glute and hip strength. So things like Jane Fonda's is something that might be very attainable for her, and help her kind of express the glute hip joint, to help provide some stability in that lunge pattern, which really made her feel uncomfortable. And then in her work assessment, she's expressed multiple times she likes to swim, she likes to walk, she likes to jog. I'm really gonna start her at map 10 because I think she can use a lot of the benefits of walking, especially outside, and I talk about that a little bit in her behavior prescriptions. She doesn't get outside that much, and so getting more sunshine and sunlight, although she reports great sleep, will still help with her circadian rhythm and overall vitality and well-being. So yeah, getting more sunlight with walking will be something that's beneficial for multiple components and help build a base of aerobic capacity, since she didn't score too high on that 10-minute bike ride. And so I think those are also types of exercise that she enjoys. She likes hiking, walking outside, and going to her lake house and doing some rowing in the canoe and things like that. So I'm gonna start with walking, and maybe incorporate some other things like the bike as we progress into map 9, map 8, map 7. So that is my interpretation of Julie's initial assessment and movement assessment, body, move, and work, and that's all. Take care.